Good afternoon. I'm Angela Brown, a Health Communication Specialist in CDC Center for Preparedness and Response, Division of Emergency Operations. Thank you for joining us for today's EPIC webinar on supporting children and adolescents during COVID-19. Today, we will hear from Dr. Melissa Brymer. If you do not wish for your participation to be recorded, please exit at this time. You can earn continuing education by completing this webinar. Instructions on how to earn continuing education can be found on our website, emergency.cdc.gov/EPIC. The course access code is EPIC 0722 with all letters capitalized. To repeat, the course access code to receive continuing education units is, in all caps, EPIC 0722. Today's webinar is interactive. To make a comment, click the chat button on your screen and then enter your thoughts. To ask a question, please use the Q&A button. The Q&A session will begin after our presenter has finished. Closed captions are available for this webinar. We are fortunate to have Dr. Melissa Brymer as our speaker today. Melissa is the Director of Terrorism and Disaster Programs of the UCLA Duke University National Center for Traumatic Stress and its National Child Traumatic Stress Network. In this capacity, she has been involved with the development of acute interventions, assessments, and educational materials in the area of terrorism, disasters, and school crises. She is one of the primary authors of the NCTSN, NCPTSD Psychological First Aid and Skills for Psychological Recovery, and has served as a consultant for many federal, state, and local agencies across the country and internationally after disasters, terrorism, mass violence, and public health emergencies, for example, COVID-19. She also serves as a lead advisor to Newton Public Schools and has established many long-term disaster mental health programs for children and families. She is a consultant for the United States Department of Education and a subject matter expert for the Disaster Mental Health Subcommittee for the National Biodefense Science Board, the Office of the Assistant Secretary of Preparedness and Response, and for Substance Abuse Mental Health Services Administration. Thank you for joining us today. Melissa, please begin.
Thank you so much, Angela. I appreciate the invitation for today and for all of you being with us so that we can talk about what are those ways we can support children and adolescents during these times. Next slide. Angela mentioned that I'm part of the NCTSN, which is the National Child Traumatic Stress Network. Our network is funded by SAMHSA, and our mission is to raise the standard of care for all types of children who have been impacted by a trauma, whether it's a medical trauma, child abuse, physical abuse, community violence, or in this case, a public health emergency such as COVID-19. Next slide. Our network is a national network. We actually have currently, as of today, 116 centers currently funded by SAMHSA. And as you can see, we're across the map. We originally started in 2001 with just 17 sites. So it's been really exciting to expand our mission and our growth. Next slide. So, you know, when back in early January, it was important for us to be thinking about how will this pandemic impact different child serving systems, whether it's our child welfare, our juvenile justice, residential programs, our acute interventions, our schools, healthcare and mental health systems, even our military and veteran families. And with that, we had to think about not every child is going to be impacted the same way. So what are some of those considerations that we have to keep in mind? Those developmental, the cultural, ethnic, racial impacts, those kids who might have had other health comorbidities or disabilities, those who have had trauma histories. And we've been trying to take this in mind as we've been creating guidance on how to have support families during this time. Next slide. So, you know, as you all know, there's some such unique aspects to COVID-19. there's the invisible threat in terms of who's infected, who's not, especially if you end up testing positive and have no symptoms. We still worry, and many of our families worry, how bad will it get in our communities? How long will this last? And because there's such a global impact, there's no community who has not been touched by this. And so we need to keep that in mind as we're creating programs and support services for our kids and families. Next slide. And so early on in the network, we really tried to take a snapshot of how has child serving systems in our kids been impacted by COVID-19. Very early on, we've had to quickly adapt to services being delivered by telehealth. We've had to make sure there is additional education and knowledge about traumatic stress and losses. Our schools had to quickly move to remote learning, and even now have to think about different modalities of teaching, whether they're going to start off remote, whether they're going to have different tracks. Some of our schools are thinking about 100% remote for some kids, and some kids might have a hybrid or be able to come back to school full time. But having to negotiate what are those safeguards to put into place so that everyone in the school community can be safe. We've had to think about what services have been limited from our child welfare to our foster care and even our transitional age youth, and thinking about some of them have described that healthcare access has been reduced, especially when there's been significant community spread of COVID. And we're hearing more and more about the impact to our providers and the level of stress or just exhaustion, and also them having to evaluate their own risk to themselves of being exposed, as well as risk to their family members. Next slide. We've heard very clearly that there's been additional risks to congregate living facilities, such as our juvenile justice facilities and our residential, concern that there might be larger spread to these communities. Some of our child populations, especially some that were already vulnerable, are immigrant and unaccompanied alien children, children with disabilities. We know, and I'll be talking a little bit more later on about some of the additional risks, as well as some of the impacts to our minority groups, including our Black families, our families of American Indian Native communities. And in particular, there's been an additional need to get evidence-based practices out there, but our providers have really had to think about how do we actually train during these times, using these distance learning platforms, but also thinking about how do we enhance adults' learning principles as we're making sure that we integrate these practices on an online platform. Next slide. And so we really need to make sure that we think about and discuss the health disparities in vulnerable populations that are being more at risk. And it's been very clearly documented by CDC and others of the disproportionate rates to Black, Hispanic, Latino, and American Indian Alaska Natives. There's many different reasons why, but we also need to appreciate that many of these vulnerable populations are part of workforces that are deemed as essential, and that they may not have that PPE available to them to help them with their safeguarding. And so we need to really think about how we all play an important role of addressing disparities during this time of COVID. Next slide. And so it's important to reflect that our kids are handling this in different ways. Some of our kids have appreciated this family time that we've had, that some of them are saying, I don't want to go back to school or to preschool, that I'm okay with staying home with everybody. Other kids, like our friend Ben here, is saying, you know what? Things aren't going so well. Mom thinks that she has it under control, but she's pretty stressed out, in that not all of us have been great at becoming teachers and helping to navigate some of the homeschooling that's been going on. Next slide. And for those of you who are parents, having to juggle being a parent right now, being a teacher, as well as doing your jobs, and many of your jobs have become more stressful in this, and having to navigate sometimes your kids showing up to some of our Zoom discussions, just seeing how difficult it is. And you know, sometimes families have worked well being together, and sometimes, especially our teenagers, are really missing their friends right now. And there's additional clashes that are going on. Next slide. So, you know, thinking about, we're all impacted by this. So what would your quote be right now? Are you one that is thinking things are going well, or is things a little bit stressful right now, especially with the return back to school? Next slide. So I think it's important to acknowledge that all of us are impacted in some way by COVID. We need to acknowledge the uncertainty is stressful and that we can't guarantee how long this is going to last. That the anxieties that our kids are expressing, that you might be expressing, is appropriate during these circumstances. That frankly, we are going to have our good days and our not so good days, and that we're not going to be perfect in everything we do right now. And that being deliberate in balancing work life and home life is so essential, especially for those of you who are still working at home right now, and really thinking about ways to create those balances and those supports right now. Next slide. So as we've been developing our programs and our services for children, we've really tried to keep in mind 5 basic principles of interventions. And you'll see Hopeful and many colleagues have created we had a task force back in 2006 that culminated into a paper. So if you think about the first one, the first intervention strategy we're keeping in mind is safety. What are those things that we need to convey to our families, to our communities, about what are those protective health behaviors that we need to be doing to ensure reduction of exposure? We have to continue to monitor what are some additional adversities that are attributed because of COVID-19, whether some of our families are experiencing economic hardships, the health disparities that I addressed. We know that some of our colleagues who work in the child abuse field are talking about that there has been additional calls and cases during this time. When there are these economic hardships, we are concerned about suicides and increases of suicides, as well as the stigma and racism that has been pretty clearly documented in many communities. So making sure that we communicate what steps to take and how we can all support ourselves, and making sure that we're limiting our media viewing, especially if it's causing additional distress amongst those that we're serving and those within our family. Next slide. The second intervention strategy is calming. So we know that in any type of disaster, especially in COVID, we know that there's additional distress, anxiety, that some of the people that we're working with are dealing with bereavement, and that we have to provide basic education on what are some of the trauma and grief reactions. How do we think about utilizing anxiety management techniques throughout our day? And when and how can we actually make sure that services are provided to those that are most impacted by some of these adversities that I talked about? And so these broad-based educational platforms that all of you have been making sure gets out is critically important, so that we can highlight what are those common strategies that can be used to help mitigate some of that distress that some of our families are experiencing. Next slide. So safety, calming, self-efficacy. Self-efficacy is really promoting that each one of us and each one of our communities has strengths. How do we tap into those strengths, even in these times of uncertainty? How do we help people to come together and connect people with the resources that they may need? We saw this early on with some of the food bank drives that were created in many communities. And with that, how do we tap into when we have to make decisions about the future of our communities, about reopening of our businesses, of our schools, that we use the public in that decision making? Because when we have more input, those policies and procedures are more likely to be effective. And so making sure that we tap into those different strengths that we have in our community, which includes tapping into those promoting activities that truly help others. And we've seen that throughout the last few months, whether it has been those food drives, encouragement of grocery stores and other stores to have senior hours so that they can shop with a little bit more protections, having those community meetings so that there can be discussions of issues that are happening in the community that needs to be problem solved. These are all important strategies to be thinking about as we're moving forward with COVID. Next slide. Connectedness is our fourth, and this is the one that has the most research to it. And this is the one that has been really challenged in COVID, because although we talked about social distancing, we really were talking about physical distancing. So there has had to be truly problem solving. How do we stay connected? And we really want to be emphasizing how do we stay engaged right now, and making sure that there is those quality engagements and that sense of solidarity to help us through these hard times. Next slide. And finally, that last category is hope. In these times, it's important to remember that COVID and the current struggles that we're dealing with are temporary. We don't know what temporary means right now. We don't have an exact timeline, but we know that other communities and other times we've been through hard times. How do we help to highlight how families have gotten through those hard times, how communities have gotten through those hard times, and thinking about ways that we can give people affirmations, gratitude, support that they can get through this, help them to hold on to those elements that are controllable, and let them see that some of their goals for their future can still happen. They might be adapted somewhat, but allowing people to still have those visions. Next slide. And so taking these principles in mind, the network has created several resources. And you can go on the bottom of these slides, you'll see that our website is nctsn.org. And there's a long description of where to get this resource. All you have to do is go to our homepage, and there's going to be a box that says COVID-19 resources. Everything I'm describing is in that box. So you just go to our homepage, and it's right in the COVID-19 resources. So it's been really important to make sure we communicate with families. How do we talk with kids, even our little kids, about what's been happening and why there's been changes within our communities because of COVID-19? This includes how do we clarify miscommunications or misperceptions or information that's out there. Checking in to see if our kids have been exposed to any racism or stigma because there might have been a family member who has been sick, or they're an essential worker and there's confusion about your child's safety. Validating our kids' feelings and thinking about what are helping to make sure that those good practices are happening, but also we want kids to be kids. And so one of our resources is how do we make sure that kids are still playing and doing those activities? So we have a whole list of fun things that kids can do. Some of that is with technology. Some of that is, let's put that technology away for a little while and let's go back to the basics of some of those good old games that we used to love as when we were kids. And there's some resources on how to start to wind down, because every family needs that routine of calm down, quiet time. Next slide. We also know that we have another resource on supporting children, of building in a little bit more details of what else we can do to support our kids during this time. That piece of creating a new routine is essential. And so even though we might have to adjust this routine at different points in time during COVID, keeping as much of that routine together is important. So if school's about to resume, what's that new schedule, and how do we make sure that we communicate that new schedule with our kids, but also highlighting that we have to stay flexible during this time, that there might be adjustments to that schedule. We really do need to acknowledge the missed developmental milestones that might have already occurred for our kids or coming up. So those birthday parties that they were looking forward to. Some of our kids had to miss their prom or graduation, and they're starting to wonder if they're going to be able to actually go to college in the fall, and some of these kind of changes. Schools have done a wonderful job in many situations of adjusting or trying to make the most of these celebrations, but we still have to acknowledge that this has been tough on our kids, and making sure that we understand some of the challenges that they're going through, that we reassure them that we're there for them, that others are there for them, even if they can't be physically with them right now. Next slide. As some of my colleagues always talk about, we need to make sure that there are resources for our young kids. So I don't know if you've gotten to see, but we have a preschool series called Trinka and Sam. It's an ebook that's downloadable. And our poor preschool mice have been through a hurricane, they've been through an earthquake and a wildfire, and Trinka and Sam are now dealing with COVID. And so it's preschool mice that also help for young elementary kids is a great way to talk about what's going on in our community. Sam's mom is an essential worker. She's a healthcare worker. And why has there been changes when she comes home, or that sometimes she's decided not to come home because she doesn't want to expose the kids to potentially COVID. We had to do something a little bit different with this series, and our Trinka and Sam has an addendum, and it's called the Trinka and Sam Questions. And that's because some of our young kids have lots of questions about COVID. How is it spread? And so you can take those pages for those kids who want a little bit more details from a scientific way, and you can add those pages to that book. Some of our kids have had family members who have been sick or who have died, and you can add those pages in too. If your kid has not experienced that, you may not want to add those discussions with your kid, and so that's why we wanted to have that in the addendum and not the full picture of the full book. And so you can see that it has been translated in multiple languages, and again, it's downloadable from our website. Next slide. So it's also been important for us to think about how do we make sure we think about keeping routines, helping to support kids as much as possible. But with that, there are going to be times that kids have additional worries or additional reactions. And so our colleagues from Yale University, one of our partners in the network, have created a resource on some of the worries, some of the clingy behavior that you might be seeing in some kids, the sleep difficulties that have been described, and they have created a resource on what are some of these reactions, why your kid might be experiencing them, and then some basic tips on what you can do to reduce these reactions. This resource is both in English and in Spanish, and again, you can grab this from our website. Next slide. I think it's so critical when we're talking about supporting kids, we also need to make sure that we're supporting us as adults. And so our Yale colleagues have also created a resource on if you are experiencing certain types of anxiety, if you're, we're hearing from so many people that sleep problems is something that's predominant amongst many of us, that we might be having our feelings, our thoughts, or just feeling overall loneliness or social isolation. And so again, this resource is, what are some of these reactions? How will I be seeing these behavioral changes, maybe in my body, in my behaviors, in my thoughts? How do I cope? But also, why does it work? When we understand why something works, we're more likely to actually make sure that we implement them. And so, again, this resource is both English and in Spanish. Next slide. And so I think it's also important, we've been really highlighting that I hope you guys each take away, what's one thing you would want to share with others that you're doing really well? I feel like I'm being an optimist. I'm able to each day teach my child something. Is there things that we're appreciative of that we're seeing good things in our community that we want to be highlighting? Do we want to be promoting our strengths? Because it's so important that we show each other and show ourselves gratitude and kindness during this time, and not always look at the negative things of how we should be doing stuff versus the good stuff that you are doing. Next slide. So many of our people that we work with are dealing with grief right now. There's been significant death because of COVID-19. And so we needed to create a resource to first, how is the death from COVID-19 different from other deaths? And we all know that some of those goodbye rituals, those mourning traditions have had to be adjusted because of this public health emergency. So how do we help kids with still being able to honor the loved one that has died, acknowledging the difficulties if they because they haven't been able to go to the hospital to say goodbye to their loved one. They might not have had some of those funerals, and are there things that can be done to adjust to allow kids to get that support that they need during this time? And is there ways to problem solve, ways to still say that goodbye, to potentially have those write a letter, or those things that might help to provide comfort for kids? And so this resource is something to help navigate through some of those adjustments. Next slide. With COVID, there's been significant economic hardships, and I don't need to describe to you just how prevalent this is. And so it's been important for us to have a series of fact sheets for our community leaders, for our parents, for our educators, including for our older youth, so our high school, college age students. And we actually took those 5 principles that I talked about before, that safety, that calming, connectedness, self-efficacy, and hope. And we put those for our economic hardships. How is safety being impacted? Including being thoughtful that when there's those financial gaps and those financial concerns, are there basic needs being met? Is there concerns about mental health and potential increases of suicidal ideation because there's that fear that hope isn't still going to be there? And you'll see in these resources that there's real tips on how do we help people to problem solve, get that support that they need, see some of the temporariness of this, and getting those finding other ways to get their needs met during this time of with this economic financial difficulties. Next slide. Schools, huge topic right now, and there's such diversity on how schools are going to look in the next couple of weeks to the next month. And so, but we all can agree that we want the best for our kids, we want the best for our educators. And so it's important for us to have a trauma-informed lens on how has COVID impacted our kids, how do we make sure there's that well-being for our staff and our students. Is there ways to even remotely think about how do we adjust learning to bring in some of these social emotional elements? Those kids who have had additional adversities, both from a trauma and a loss lens, are we making sure that we give them services, that we provide education, just like we have been during these times, but in schools to educate why are we feeling this way, what are some of those needs, and what are those evidence-based treatments that are available either at school or in the community to address some of these issues. And so we have a resource that spells out some of these trauma-informed perspectives, including making sure that we're promoting cultural responsiveness during these times. Next slide. You'll see here we have some resources for our juvenile justice system, from our judges to our legal professionals and court personnel who, if we make sure that they understand what are their safety concerns, what are things that they can be doing for themselves, as well as for the youth that they serve. And then thinking about all the supervisors to the youth to the frontline workers. Again, what are those steps that we can be doing to enhance each of us that are working in those systems? And so some of you might be interested in these resources. Next slide. I mentioned with the economic hardships that during these times we have to be making sure that how do we support our youth who might have some suicidal ideation. And so one of our colleagues from both UCLA Duke has actually created a resource on how to actually do assessments of youth who might be suicidal using telehealth. And so some of you might want to make sure that you have that guidance, as well as thinking about how some of our youth, such as our LGBTQ youth, might be more vulnerable during this time. What are ways that we can be doing outreach, and how do we make sure that we're assessing for suicide and supporting them during this time? When there has been a suicide that's a completed suicide, how do we support those families with that death as well? And so you'll see that we have different resources, both how to assess and prevent, as well as if there was a completed suicide. Next slide. I think it's been absolutely critical that we make sure that we provide support for families who might be experiencing intimate partner violence. And so we have a fact sheets that are a 10-part series that we just translated into Spanish about ways that kids might be impacted by intimate partner violence, coping strategies that can be used, and what other resources are available. So I would make sure to take a look at those resources. Next slide. And I think it's absolutely critical when we're talking about suicide, domestic violence, child abuse, that we make sure we educate everyone in our community that if they can't get access to a mental health provider, that there are amazing hotlines that are available. So we have that suicide prevention lifeline, the disaster distress hotline. There are some that are specific to certain populations. Strong Heart are for Native American helpline, and sometimes the Veterans Association has a veterans hotline that is geared to our military veterans. So it's important that we also educate that if you're in distress, get help. And there's resources that are available now so that you can start that journey of getting help. Next slide. And with this, it's been critical to think about how do we, even if we are supporting our communities, or if I am actively working with certain clients, it's important in this time to stop and see how is COVID impacting. And so for many of you who do this work, it's important to think about psychological first aid, which is that early intervention that makes us ask those questions. Am I getting my basic needs met? Do I have difficulty coping right now with some of my reactions and I need some basic support? Do I need help problem solving, reconnecting with some of my support systems? And so PFA does a great job of this. I know that there was a talk that SAMHSA did that covered psychological first aid in a little bit more details. Our website has the English version of the manual as well as the translation. And we do have an online course that's free on our Learning Center. And we also have a mobile app for both the iOS and Android mobile devices. So I would say take a look at that and think about truly encouraging your team to take the online course. Next slide. So COVID, we are dealing with changes in our community where there might be surges that we need to be thinking about what's happening now and some of those urgent needs of those that we serve. But then we also have to support families with some of the secondary adversities that might have, because of the economic impacts, their jobs might not have come back. Some of their social relationships might have been strained. And so skills for psychological recovery is for that intermediate intervention. It's when we have that time to, for a little bit more support with somebody to help them truly problem solve ways that they can get their goals met. Making sure that they're doing those things to take care of themselves. In the middle of, back in March, we actually launched our online course. So if you haven't had a chance to take a look at it, it's a good time to take a look at it. So again, the SPR manual is on our website, and the learning, again, these are all free resources, and you get CE credits as well by learning a little bit more about skills for psychological recovery and thinking about those skills that you can provide those that you're serving to help with some of that distress and increase positive coping. Next slide. So I'm just nearing our end so that we can have some discussion together, but I always think it's critical that we take that moment and making sure that you're taking care of yourself during this time. So I always, since I'm a school and a kid person, don't forget your ABCs. Are we thinking about awareness? Are we actually doing those body scans of what kind of stress is your body experiencing right now? Are you doing things that overworking, overeating, ignoring your feelings because the stress is too much right now? Are we then thinking about the B, the balance, that are we creating balance between home life and work life? Are we doing those things that we're intentionally doing those things that enhance well-being? Every night I make sure I go outside for a walk, that I intentionally take those breaks throughout the day, even if it's just for a minute or two, so I can reset my cognitions. And that we really need to think about how do we stay engaged even in this time that our work setting might be altered. And so regularly connecting with coworkers, with friends, people of our faith, using time, making those connections, and frankly celebrating success. It's easy for us to look at how much work that has to be done, but don't forget what you have done and will be doing, and the changes that you're making in families' lives and in your own life right now. So I think it's important that we attend to these aspects. Next slide. And praising yourselves for the good job that you are doing, and making sure that we praise our parents and our caregivers for the roles that they've been doing. And with that, I think we have plenty of time for questions and answers, and look forward to a great dialogue.
Thank you for that presentation, Melissa. Jonathan, will you read the first question, please?
Hi, everyone. Thank you. Yes, we have some excellent questions, too. Melissa, the first question that came in is kind of asking to clarify about what is meant by survival brain, emotional brain, and executive brain.
I'm not sure I have those answered right this second.
Sometimes that happens. I thought just if you could follow up by emailing epic@cdc.gov, we can follow up on those kinds of requests.
Definitely.
So, okay. The next question was, can you suggest ways volunteers can help kids right now, given that they can't be with them physically?
I think there's a lot of different ways that we can, volunteers can participate. So I've seen, for example, some communities have summer camps that are remote right now, and they're all looking for volunteers. I know that some organizations are wanting to, how do we get the word out to our youth about that we are there for them, that there are supports for them? And so sometimes some of my wonderful volunteers know how to use some of these technologies, and as much as I wish I could, I'm not a TikToker, for example, but some of our volunteers have these talents that we can get some of these messages out to those platforms that kids are using, so that we can make sure that they know that we care for them, that we want to support, and that there are things that they can be doing to take care of each other. So volunteers should definitely be willing to participate with great organizations that are doing this kind of work.
That's great. Okay. We had one questioner ask if the resilience of children has changed over time, if they're more or less resilient than they used to be.
Sometimes we feel like our resilience has changed. And so that goes back to my concept of hope. We're hearing a lot of people use the word exhaustion right now. And so sometimes we have to be reminded of those strengths that we have. And so I will go to that child, or even to that parent, of what skills have you used in the past under other times that you've been stressed, or other times that there's been something difficult that have happened in the family. Are you using those right now? Or are they working? And many times we'll find that families are using or do have creative ways. They're just forgetting that they have those and so sometimes we just need to give some of those reminders. The uncertainty of how long do I have to maintain this is also making people question their resiliency. And sometimes we might have to help people to chunk, okay, what's your routine going to be from now until the end of the year for the school year? what's that going to be like, rather than having to have a plan until the end when we're not sure what that looks like right now. So we might have to chunk time so that it feels more manageable to get through this everything.
Okay, thank you. Our next question was about setting family cleaning schedules. And I wanted to bring that up because I wanted to know if it's helpful for children to be a part of sort of the survival routine of the family.
That is definitely in our family handout. That part of that routine is doing chores. I know if there's any kids on the listening, they probably are shaking their head like, no, but we all have to show that we all have a part in supporting our family, and a kid's task is that those chores and helping them with developmentally appropriate, but having that as part of that routine. And it's sometimes also, as those chores change as they get older, life skills, so that they can do these tasks when they're out on their own. So absolutely, those have to be there.
And all the parents are watching now going, yeah, but getting them to actually do chores, you don't understand.
Well,
We
that's a
feel your
different, absolutely. And that's where sometimes we have to do that positive parenting and praising when they start some of those chores, or when they do that. How do we highlight, like, I love how you started cleaning up your dishes after dinner. I really appreciate you doing that. Because sometimes when we're under stress, we focus on what they're not doing. And so sometimes we actually have to make sure that we're promoting and praising that stuff that they are doing. Even if they didn't quite finish it, praise that they started it, so that kids want our positive attention. And so if there's ways that we can be praising some of these tasks, you'll see that some of those behaviors will increase.
Great. Okay. The next question asks about convincing children to do certain things, to embrace the sense, to own protectiveness toward their grandparents who may be more vulnerable. Can you speak to that?
Absolutely. First, we have to acknowledge that for some of our kids, they have such strong connections with their grandparents, they miss their grandparents. Part of their not wanting to protect is that they're missing that bond. So can we help to problem solve things that they can be doing? If Zoom or FaceTime's not working, can they send letters? Can they bake things and put it outside their door? What are those things? Because some of it is, I just miss them. And so if we don't acknowledge that how much they're missing and how much that hurts, they're not going to want to follow through. So I think we need to first acknowledge, and then highlight that this virus impacts certain people differently, and that it's very clear that some of our elderly have to be protected, and that we can't be with them in that same way right now. And having those discussions, some of the kids want to know why. And that's why, for example, Trinka and Sam, we ended up adding in more details, because how the virus is spread, why is our certain people more vulnerable, because they want to understand a little bit more. So if they understand why this is actually going to protect their older adults, what they can do in this meantime to make sure that they still have that bond and that connection, and is there other things, activities as a family you can be doing so that you don't miss those connections altogether. And we have to acknowledge to our older adults too that this is hard on them. I've heard from many grandparents who are just devastated that there's a new family member been introduced to their family, and they haven't been able to see that baby and not have that bond, and how difficult it is. So we need to make sure we're acknowledging it on their side of they know what they're missing and how hard it is.
Well, and the next question I was going to read asked, What can I do about helping my grandson understand that he can see me but not touch me at this time? Because, I mean, they hug a lot.
They
Yeah.
do hug. So is there a special stuffed animal that you can each have, for example, depending on how old your child is, and that you hug that stuffed animal and they also hug their own stuffed animal? Or is there, I've seen certain family members will, instead of hug, is there now a sign or something that you guys both do that shows that affection, but that might not be the hug? So we can't have the hug, but is there other endurements that you can share together that is your sign of showing love and support? And or is there a song that you guys would sing to say hello or goodbye? Kids like those little special signs that can have that connection. So let's not take it, not the hug shows we care about somebody, but it doesn't mean we have to take away that completely. We can adapt it, and that's where I hope we can get, so that they can still have those beautiful connections together. It just might not be that hug.
You're suggesting like get matching for young kids, get
Yeah.
matching stuffed animals, and like this stuffed animal for you, that's me, and your stuffed animal is you in my place, and then you hug the stuffed animal at the same time. What a great idea. Okay.
And it gives you that comfort when you can't have that hug, you have something to squeeze as well, which is what kids need sometimes. They need to, they're sad that they couldn't have that, but at least they have that other object to hug right now. That's safe to do.
That is really a great idea. Mandy works at a public library and was asking if it would be okay for them to print and share with their patrons some of your materials.
Absolutely. We have seen librarians, you guys are our biggest advocates of really getting messages out to our families. So I hope you do. And Trinka and Sam, a lot of libraries have used Trinka and Sam too.
Okay. So to that end, Linda was asking about sharing the slides and I assume other materials as well with school personnel. So I wanted to add to that. Can you make suggestions for sharing some of these thoughts for parents to encourage their schools to adopt some of these practices?
So I think there's a couple of strategies that I've seen communities use. PTAs have a very, in many school districts have a big voice. And so PTAs sometimes have newsletters, even electronically nowadays, where messages can get out to other parents, and there can be connections to the resources. We can be encouraging that that school websites a lot of times have community resources. So are they linking to these resources or others that you might know of that talk about how to support kids during these times? So are we making sure that there are those linkages to your school website and also any kind of mental health authority or community-based mental health practice that they can also be linking to them? Social media, I know, is a positive and a negative, but we can also help our schools get messages out. Hey, we know that this is a stressful time to make decisions about what type of placement you want for your child, when there's some school districts that are making you choose between all completely online or a hybrid. Can there also be, I hope you're taking care of yourself. So we can help schools to make sure that there's we get that this is stressful decision making. Here's things that you can do to take care of yourself, and make sure that we add those types of messaging and then connect to resources that help with positive coping. Right now it's just make these decisions. And I think we can encourage our school boards, our educators, let them know that there's these additional resources, and even creating a couple of these messages.
Great, thank you. I'm going to take one last question before we close out the webinar. It is this questioner is asking a question that I actually share anxiety over this, which is that the social isolation could be causing children to become more socially awkward because they're not having that practice.
Absolutely. I have a few kids that are in my practice or that are anxious kids, and they love being at home right now. And they've told their parents they prefer the remote learning, not because it's the right thing, but they have a comfortability. And so part of what we need to be doing, and school counselors will need to support kids on how to actually reintegrate into, and part of in helping them make sure that they don't stay socially isolated forever. You know, there is this temporary piece of this, but we actually have to spend time for those kids that are in this comfort zone, and we need to make sure that they get out of that. So just as we do with some anxiety treatments, helping them to get re-engaged. What does that mean? How do they maybe participate in sports when it's okay, or different clubs, or getting involved in different ways in the community? I think we have to really look at that engagement piece and make sure that they don't stay disengaged.
Okay, that's great. Well, thank you. And it looks like we're kind of running low, so I'm going to toss this back to Angela. Angela?
Thank you again for joining us for today's webinar. If you have additional questions, you may email them to epic@cdc.gov. As a reminder, today's presentation has been recorded, and you can earn continuing education units for your participation. Please follow the instructions found on emergency.cdc.gov/EPIC. The course access code is EPIC 0722 with all letters capitalized. Again, we'd like to thank you for joining us today, and have a wonderful evening. Goodbye.